when we were in our own bubble, so when we were going to Heroes, Archway nightclub, going out in the scene, you were still quite protected. But in the workplace, I worked in Blackburn, and I distinctly remember one of the admin staff saying to me, have you had a drink from that cup? I said, yeah. She said, oh, right, okay. And I knew, Jenny was her name, I said, is there an issue? She said, oh, I've just seen all this media coverage. And so there was the odd example, it wasn't every day, but there was the odd example where you could sense that the real ignorance, the fear of people, and fear of gay men, basically. So there was, I think, you found sort of comfort in your own world, but there was definitely some really difficult, and it's interesting from a way point of view. There was at Monsell Hospital, we were very lucky because there were some fantastic clinicians, Director of Public Health at the time, Joyce Leeson, great advocates, really speaking up. So it wasn't just lesbians and gay men, it was sort of some lead clinicians in the city. But the ignorance and the basic fear and the basic understanding of infection control literally was quite shocking when you look back. And then to go on the phone lines at Manchester AIDS line, and that I think I was about the third intake of volunteers, so it's still quite a small organisation, and to go on those phone lines, and to be fair to people, most of them were ringing with their own personal concerns, but it was everything from someone sneezed next to me, can I catch it, to people who'd obviously put themselves at risk, and you're trying to direct them to services. So there was a lot of, and the phone, when we set up the helpline, the volume of calls was unbelievable. We were extending the hours of that line, getting more volunteers. And it culminated, Don't Die of Ignorance, 1987, the AIDS Week, as they called it on television, where they coordinated a set of television programmes across BBC, ITV, and we, Manchester AIDS Line, were asked to staff the phone lines at Granada TV studios. And it was great because the Coronation Street stars, Vera Duckworth, I remember, they were great actually. They came in, you're all right, made us cups of tea. It felt as though that was a watershed of trying to create, wherever the criticisms of the ad campaign are, it did actually lead to that recognition that there needs to be more public awareness. And actually, I think after that, things started to, there was still the stigma. I'm not saying it went away in 1987, but it felt like a watershed moment for me in terms of just that coverage, trying to reduce some of the fear, and yeah, it was a key time. But that I'd say through the 80s and most of the 90s, a lot of that fear and ignorance didn't go away. And I remember going on the Clause 28 march in February 1988, and that felt quite cathartic in terms of, yes, it was about Clause 28, but it also was about HIV and AIDS. It was about a range of issues, and Manchester felt a great place because there'd always been the history of tolerance and openness. The council had set a good example. It's got its faults, but it did provide some civic leadership, and it helped, I think, groups and organisations to develop, and also, we saw the scene sort of expand in the 90s, but in the 80s it had a sense of connectivity that I wouldn't, I don't want to look through rose-tinted glasses, but there is it was a time of, I think, solidarity and really strong community spirit, and some good new relationships established between, bizarrely, the voluntary and community sector and some of the clinicians in the city that made a huge difference. And Manchester, at MRI, at Withington, and particularly North Manchester General, I think provided that assurance that there were great clinical services. People didn't have to go to London. They could get the support here. So I think it was a challenging time, but also a time then that we saw some really good services that are still here to this day, established.